Welcome to the Alphagenix Podcast, where every week we speak to incredible guests from the world of health, wellness, longevity, biohacking, and of course, men's health. And I'm delighted today to welcome Dr. Philip Borg, founder of the Longevity Doctor. Philip, welcome to the podcast.
Thank you, Ross. Thank you for inviting me.
Oh, no problem. I'm super excited about this one. For the last probably 5 years plus, longevity medicine, I think from the first moment I heard what a telomere was, I was all in reading all sorts of, different articles and books. So for anyone who doesn't know, what is longevity medicine?
Right. So first of all, I'm a longevity medicine specialist. I'm also a NHS consultant. So I'm also a cancer interventional radiologist at the Christie Hospital in Manchester, which is the largest cancer hospital in Europe. So longevity medicine is preventative medicine. And we focus on increasing our patients' lifespan as well as health span. So health span is how well you live, and lifespan is obviously how long you live. And this model of medicine is different to what most people know as the current medical model. So in my NHS role, for example, I treat patients with cancer and we wait for symptoms to arise. Whereas what we focus on in longevity medicine is we actually try to see patients, treat patients, and do whatever we can to prevent the onset of those symptoms. So in a way, you can think of longevity medicine being wellness medicine, whereas the standard model that I practice in my NHS practice is sickness medicine.
Yeah, that sort of old adage of, prevention is better than cure is exactly what we're looking at. It sounds wrong when you say it out loud that traditional medicine is sickness medicine. Like we have to wait for symptoms to, for something to happen. It doesn't sound right, does it, when you say it out loud? Surely we should be looking at wellness medicine.
It doesn't sound right. And the strange thing is that, I was in medical school maybe 20 years ago now. And it's strange that I've practiced medicine for so long. And virtually nothing of what we did in medical school was to do with prevention, or a lot of the things that I talk about, like there was nothing about exercise, nothing about sleep. And I don't know, I'd like to think that things have moved on a bit, but I'm not sure that they are teaching any of that in medical school at the moment.
Well, I guess then, what first drew you to medicine? And then what prompted the change? When did you think there might be another way to look at this? And how did you then sort of move to wellness or longevity medicine?
Well, I've always been interested in medicine. Ever since I was a kid, I was always fascinated by things like surgery and what doctors did in hospitals. It was always like this fascination I had. And so I started medical school, and I was drawn to radiology, specifically interventional radiology, because I was fascinated how doctors could do tiny interventions without putting patients to sleep or opening them up. It's always been my dream to be an interventional radiologist, and I'm so happy and so grateful that I get to treat patients with cancer every day of my life. Every single patient I treat is so grateful for what we do. But it always struck me that, we're reaching patients at the wrong time in their journey. Like most people, I've had, loved ones who've passed away for all sorts of reasons, including cancer, heart disease. And that got me interested in thinking, what can I do for my patients, for my loved ones, for myself even, to prevent the onset of these diseases? Anybody who has any of these diseases would turn back the years and say, what could I have possibly done to prevent being in this situation? So a couple of years ago, I did a bit of research and I started doing a fellowship in anti-aging and functional medicine in the States. And completed that. It was an amazing experience. The healthcare system in the States is obviously very different. Some of it good, some of it bad, but certainly the idea of prevention is very well established in the whole healthcare system, but also in patients' minds. What I find in the UK is that everybody finds this really interesting, but it's such a new concept that people kind of, same as you said, it sounds wrong speaking about wellness and sickness medicine. And yeah, so this is what we're trying to do. We're trying to change the way people think about healthcare.
Yeah, I love that. So it was quite a sort of a gradual journey then, where you just started taking more of an interest. What can I really do to make a difference to my patients' lives? And that's led you to where you are now.
Yeah.
And you mentioned obviously cancer a number of times. Is that your main focus, or are there other diseases that we're trying to change with longevity medicine as well?
Yeah, so cancer is, so what we're trying to do is help people live longer, healthier lives. Cancer and cancer screening and cancer prevention is a big part of it, but there are other diseases that we're trying to prevent. So let's define a few things. So longevity medicine is about health span and lifespan. So we all want to live longer lives, but we all want to live longer lives of good quality. Nobody wants to live the last 10 years of their life being unfit and unable to do the things that they love, like travel independently or exercise or playing golf or whatever you want to do. And this is the problem with the current model of our healthcare system. So we wait until something's wrong, and then we throw all our resources, very expensive resources, into prolonging patients' lives at the very end. And many times, unfortunately, that quality at the end is not great. So if you had to have a choice, you'd love to have an extra 5 or 10 years, but you wouldn't want it being on chemotherapy or living with dementia or living with heart failure, for example.
Yeah.
So in answer to your question, the diseases that we're trying to prevent are the ones associated with aging. So just a bit of statistics here. So 80% of the deaths of people above age 50 who do not smoke are caused by 4 main disease types.
80%. Wow.
So you've got cardiovascular disease. So we've got heart disease, strokes, cancer, Alzheimer's disease. And finally, you've got metabolic disease, which includes things like diabetes and insulin resistance and non-alcoholic fatty liver disease. So these are the 4 main diseases that we are trying to avoid. Obviously, apart from causing 80% of deaths, these diseases are also the cause of morbidity in the older population, so the cause of loss of quality of life in the final years.
Yeah, wow, that's powerful, isn't it? All boils down to 4 things.
Yeah.
So what do you teach when patients come to see you for preventative medicine?
So it's important to realize, so education is a really big part of what I do. So I always say educated patients are motivated patients. And it's important to realize that all these diseases that I mentioned do not happen overnight. They don't happen suddenly. So there's sometimes 10, 20, 30 years of these diseases progressing before a symptom arises. So for example, heart disease. From autopsies that researchers have done in young patients, you can actually see the beginning of plaque formation in arteries in young patients. So by the time the first heart attack arises, that process of build-up of plaque in the arteries has been happening for 10 or 20 years.
Yeah.
Unfortunately, sometimes a heart attack can be the first presentation of that disease, which can sometimes be fatal. So I think that's a really powerful thing that struck me, that a significant number of people do not know that they have heart disease until they have their first heart attack, which may kill them.
Which is scary, isn't it?
Really?
we talk about this often at Alphagenix because obviously you'll be aware of this, but it's a statistic that I'm amazed more men don't know. But erectile dysfunction is one of the first early warning signs, isn't it, that you could be heading towards a cardiac event in 7 or 8 years.
Yeah.
And yet we don't talk about it openly as men.
That's crazy. I mean, another thing is, so all of these diseases. So, we mentioned heart disease, Alzheimer's disease, exactly the same. So if you had to look at a patient's brain 20 years before the diagnosis of Alzheimer's disease, and you look at it under a microscope, you can actually see the pathological processes of tau protein buildup and beta amyloids. And during this preclinical stage, there's very, very little symptoms or, very mild cognitive decline. Patients can seem slightly off to the relatives. By the time you actually reach a stage of Alzheimer's disease, it's so advanced that, unfortunately, there are some new drugs on the market, but all they do is slow the rate of decline. So in many ways, by the time you've reached a diagnosis of Alzheimer's disease, then there's not that much you can do.
Wow.
But there's a lot you can do to prevent or decrease your risk of developing Alzheimer's. Cancer, a similar story. So research has shown us that, for example, in breast cancer and colon cancer, those cancer cells have been there multiplying and changing for at least 10 years before they become a detectable lump.
Wow.
So this is why cancer screening is so important. So another interesting statistic is that, let's take colorectal cancer, for example, one of the biggest killers. Your 5-year survival rate, so that's your chances of surviving 5 years if your colon cancer has been detected at stage 1 is 90%. If you find your colon cancer at stage 4, so a bigger cancer that's spread to other organs, the chances of surviving 5 years are 10%.
Wow, 90 to 10.
So, massive difference. And I'm sure every single patient who's diagnosed with cancer wonders, what could I have done to prevent being in this situation?
Yeah, and is the answer is probably both, but is the answer that we screen more often earlier, or is it that we just need to change fundamental things in, the way we live our lives to stop it from happening in the first place?
I think a bit of both. So we'll talk about cancer screening a bit later on, but there's 2 rules for cancer. Firstly, try whatever you do not to get cancer. And secondly, if you do get cancer, it's so important to catch it early.
Yeah.
That's where cancer screening comes in.
And is there anything we can do, or is it just genetic? Like, if you're going to get it, are you going to get it? Because we've all heard stories of, people living perfectly healthy lives, never smoked a cigarette in their life, and then they get lung cancer and die.
That's unfortunately a really common story, and there is a lot we can do. So another statistic, because I love statistics, 38% of cancers are preventable. So they are caused by modifiable risk factors.
Such as what?
Number 1, smoking.
Mm-hmm.
So, for whoever's still out there, first-hand smoking or even second-hand smoking, being in bars or being around people who smoke, that's the biggest risk factor. And the second risk factor is obesity. Now, obesity and being overweight are risk factors for all sorts of reasons, but mostly to do with your metabolic health.
Yeah.
So anything that leads to being obese or overweight, so overeating, eating, ultra-processed foods, leading a sedentary lifestyle, all these things are risk factors for cancer. And this is, I'm seeing a surprised look on your face, but this is, something that I hear quite often. Many people are surprised that, they can do something to prevent cancer. So all these diseases don't just happen. It's not kind of, written in the stars, which is something that a patient told me recently, that, it's written in the stars that I'm going to get cancer because my aunt had cancer or whatever. Yes, there is a genetic component, but only 5% of cancers are caused by familial causes.
Wow. That's
Irritability is caused by lifestyle factors which we can modify, and then there's other things that you can't control. So, like exposure to toxins and just bad luck, to be honest. But for those 38% of cases that we can do something, then we should be doing something.
Obviously, smoking we're all familiar with that, but I genuinely didn't know that being overweight, I know being obese has all sorts of problems.
Yeah.
But I didn't know it caused cancer.
Yeah, I mean, you're not the first person to tell me this, and it's surprising how. I mean, to be honest, when I was in medical school, I don't think this was ever mentioned to me, and I don't think it's something that's come out recently. So, yeah, metabolic health and cancer are very strongly related. So, whatever you can to remain lean, remain fit, do it. So, incidentally, all of these diseases that we mentioned and all the preventive measures that I try to teach my patients prevent all of the diseases that we spoke about. So obviously being fit and being lean decreases your risk of heart disease, cancer as we spoke about, but Alzheimer's disease. So we know that the more you exercise, the more our brain releases certain proteins that increases the blood flow and helps with removal of these tau proteins and beta amyloids. Sleep is another thing that I'm very big on, and I tell my patients. So when we sleep, there's this system in your brain. This is only a recent discovery. It's called the glymphatic system, and that's kind of like the waste disposal mechanism in your brain.
Mm-hmm.
If we manage to get a good 7 or 8 hours of sleep every day, then your brain has more of a chance to take away these waste products. And we haven't quite reached the link between removal of waste products and Alzheimer's disease, but we could probably make that link. That certainly people who sleep consistently have a decreased risk of Alzheimer's disease.
Wow. Okay. What about napping then? If little sort of 20-minute, half an hour naps during the day, does that?
Yeah. So different people are different for us. Okay. So there's no one size fits all kind of medicine approach, but napping, yeah, any form of sleep is going to help you with decreasing the risk of Alzheimer's disease. Some people find that if they nap during the day, then they don't get a good night's rest. So what I would say is find whatever works for you.
Mm-hmm.
Your sleep is not only about the length of sleep, it's also about your quality. So if you find that you have a little nap in the afternoon and you feel great, then fine, go for it. But if you find that you're not sleeping well at night, then I'll probably skip that nap. Interestingly, people who sleep more than 9 hours are at increased risk of Alzheimer's disease.
All right, so there's that kind of sweet spot.
Yeah, there is a sweet spot.
Fascinating. Mm. I guess going back to sort of the obesity and the link there, and you mentioned about metabolic health, it kind of makes sense, I guess, when you're talking about metabolic health, doesn't it? And goes back to the type of food that we're putting in our body. If you were living like an insulin-controlled life where you're avoiding processed foods, lots of sugar, things like that, your blood sugar is not going up and down, which causes an oxidative stress, stress in the metabolic system. So yeah, it makes sense. If you eat well, exercise efficiently, keep the metabolic health down, well, you're very unlikely to be obese anyway.
Very true. So in a way, you can think of obesity as being a marker of what's going on inside your body. It's not the actual fact that you've got too much fat. The same reasons you've got too much fat are the same reasons you're likely to develop the rest of these diseases.
Yeah. What do you say to people then that say, I'm fat because of my genetics?
So this is also a common question I get. Some people do have a genetic predisposition, and there's also very interesting research to show that your gut microbiome plays a really important role.
Yeah.
And this amazing study in only a few patients that transplanted the gut microbiome from obese patients to lean patients, and those lean patients with a new gut microbiome were more likely to put on weight. So genetics does play a role, gut microbiome does play a role, but at the end of the day, it's so simple. The only way to lose weight is to eat less calories. If you don't eat extra calories, then you're not going to have extra weight.
Yeah.
Of things that leads to overeating. So first of all, you mentioned ultra-processed foods. So these food companies have got labs of scientists whose only interest is in creating a product that's going to sell more. They don't care about your health. They don't care about what it's doing to the rest of your body. All they care about is how are we going to make a product that people are going to keep coming back for. And apart from coming back for, overeating is obviously going to increase their sales as well. So junk food, lack of sleep, that's another issue with not sleeping enough. You get more food cravings.
Mm-hmm.
People who are underslept have higher levels of cortisol, our stress hormone. That leads to being overweight. So yeah, there's all sorts of things. So in answer to your question, yes, genetics does play a small role, but at the end of the day, if you eat less, you're definitely going to lose weight.
Yeah, I guess otherwise, Ozempic and the other GLP-1 agonists, they've hit the media lately, haven't they? Been sanctioned by the NHS, but those type of medications wouldn't work if it was genetically. You'd still be overweight regardless, but actually, if you don't put it in your mouth, then you don't get fat.
Always. The interesting thing about Ozempic is that I think it does have a role in some patients, specifically the very obese patients. But losing weight is actually a bit of a misnomer. As you know, you don't want to lose weight; you want to lose fat.
Yeah.
So ideally, you keep muscle and you can lose fat. The problem with Ozempic is that actually it leads to a significant decrease in your muscle mass as well, which isn't great. So Ozempic is not for everybody. I think it has very good health benefits for people who are extremely overweight, in the obese section. But, a lot of people who are kind of, relatively normal weight and want to lose that kind of little bit of belly fat ask me about Ozempic, and I say this drug is not for you. Certainly, if you want to think about your long-term metabolic health, the only way to do that safely is to, the simple things. Eat a good diet, exercise more, and sleep well.
Mm-hmm. And is there a perfect diet for longevity medicine?
Well, I like to talk about an anti-inflammatory diet, or some people might know this as a Mediterranean diet.
Mm-hmm.
So it's what most people would think of. So certainly avoiding ultra-processed foods, trying to eat a lot of plants, organic, ideally, lean meats like fish, chicken. Try and stay away from red meat, although a bit of red meat is fine, high in protein. And basically a high fiber, plant-based with a bit of protein, and stay away from ultra-processed synthetic sugars. That's pretty much it.
Yeah. I like the paleo diet. It's very, very similar.
Yeah, very similar.
If it ran, swam, slithered, or grew, eat it. If it has an ingredients list on the back, probably don't put it in your mouth. That's kind of it.
I think that's a great description of what you should be eating. But I don't like to be terribly prescriptive about what people should eat. What I find is that if I'm very restrictive about what people eat, they stick to it for like a month or two.
Yeah.
And then they kind of just go back to their old ways. What I like to do with my patients is we go through a assessment, and then I come up with a lifestyle intervention plan in combination with the patient. I'm trying to set out achievable goals that they can keep for the rest of their lives. This is not a 1 month or a 2 month fix. We're trying to think about how you can live well for the rest of your life. And those benefits are immediate because you feel better, but you're also less likely to develop disease later on in life.
I love that. That's super powerful, isn't it? Especially if you link that to why do you want to live longer? Is it to look after your grandchildren or meet your great-grandchildren?
And be able to play with them, carry them, you know. So many people do meet their grandchildren and their great-grandchildren, but it's no fun if, you know, you're lying in bed and, you know, not being able to play with them or travel with them. So the idea is that you're going to be fit and healthy and doing whatever you can to enjoy your life at the end.
Yeah, I love that. A question that we ask in our family all the time is, would you like to live forever? And it always prompts quite an interesting conversation, you know, just with the four of us. But if I can ask that question to you, obviously as a longevity doctor, would you like to live forever? Would you like to be immortal? If there was a way through medicine, would you pursue it?
I don't think so. Not for myself anyway. And I think the beauty of the way we live our lives is that, you know, we know that there is an end to it. If there wasn't an end to it, I don't think there'd be much point in, you know, what we do. Why would you wake up in the morning and try and achieve something if you knew you've got, you know, forever to achieve it? So, yeah, whilst I do want to try and live a longer, healthier life, you know, I don't think I would. What about you? What do you think?
I would love to, yeah.
Really? Wow.
Yeah, as long as I was healthy. If I was fit, healthy, you know, had all my faculties, then yeah, I'd love to, you know. And then it prompts the question, well, you know, what if your loved ones passed away and all those horrible things? But I'd love to see where we end up in another, you know, 500 years or 1,000 years.
Yeah.
That would be quite fascinating. Yeah,
we are living longer, and you know, the technology is there to help people live longer. It's just, you know, how do you get that technology out to vast areas of the population? So you're getting there. Maybe not immortals, but yeah.
I think we all know the answer to this, but because all of our cells regenerate, don't they?
Yeah.
Over a period of time. So you get to a certain point in your life, and all of your cells are different anyway. So you're not the same person you were when you were born. So arguably, if you're a completely different biological entity at that point, what's the difference between just transferring your consciousness into another biological entity? Like, surely that's the same.
Yeah, well, I mean, not all your cells replicate, but I see where you're coming from. You know, so certainly your brain doesn't regenerate, which is one of the problems with things like take the brain out, put it in. Sounds like some sort of sci-fi movie.
Yeah, but it might happen at some point in the future, I guess.
Maybe you never know. Not for me, maybe for you, Ross, but yeah, I wouldn't want that.
So how long would you like to live, and how long do you think it's realistic that as a species we should be aiming for?
I think certainly there are a lot of people alive today that will easily live to age 120. Easily. So the current oldest person, you know, documented oldest person has lived to 122.
Wow.
So, whilst, you know, they're obviously an outlier, I think with, you know, the current technology and the current research that we're doing, which is obviously progressing, you know, so I'm only 40 now, only. But as I get older, obviously things are hopefully going to get better, you know, in terms of avoiding diseases that might kill one of us. So, like, you know, cancer screening, heart disease. There's a lot of research on making organs as replacements for your heart. So, you know, maybe sometime in the future, if one of us did have a heart attack, then, you know, the simplest thing would be, rather than trying to open up your artery, just give you a new heart. You know, that's in the pipeline. Yeah, so I think 120 is definitely going to be achievable. So we think of kind of age 80 now being the, like 82, 84, depending if you're male or female, being the average. Then, you know, if the average moved to age 120, then obviously there'll be outliers that would live much longer and much less. So yeah, interesting times ahead, I think.
Yeah, wow. So we could only be a third of our way through our lives right now.
That's the way I'd like to think about it, but hey, we'll see.
Amazing. You mentioned something there again, which we talked about earlier briefly, which was the cancer screening.
Yeah.
So this is something you're really passionate about, isn't it? So how does that tie into what you do?
Sure. So patients come to see me for two main reasons. So firstly, we have this longevity annual check. And we'll talk about the longevity annual a bit later on. But secondly, we have a cancer screening program. So as I mentioned before, the first rule is, education. Try whatever you do to prevent getting cancer. So in our lifestyle intervention program, we go through the risk factors of, your blood tests. What does your HbA1c show about your glucose control? We do a physical examination on including your weight, your waistline, your blood pressure. We assess alcohol consumption, so that's another risk factor for cancer. We assess your diet, and all these things we try and put together and change what you're doing in your life to prevent all those risks. But some people are going to get cancer, and the best way to beat cancer is to catch it early.
Mm-hmm.
We have a cancer screening program, and during this cancer screening program, we ask questions like, family history, how many relatives have you had who've had cancer, what specific types of cancer, your own personal risk factors, and we come up with a cancer screening program. So, for example, if someone was particularly high risk for colon cancer, or if they had a strong family history, then we know that the gold standard is colonoscopy.
Mm-hmm.
We get colonoscopies every 3 years, and that will allow us to pick up tumors when they're tiny. So we know the progression of colon cancer goes from small polyps to increase in size and eventually become cancers that can spread to other organs. So we catch them at a very small size. We can take them off and they stop growing. So we also then offer another amazing new technology called a liquid biopsy. So there's a company called TrueCheck. So there's many liquid biopsies out there. So liquid biopsy is a name for a blood test. Basically, what we're doing is a nurse comes out to your home, they take a blood sample, and that blood sample is sent off to the lab. And the scientists in the lab are looking for tumor cells in your blood.
Wow.
And so what they do is they can actually detect the tumor cells and find out where they've originated from.
And does that show all kinds of cancer, or does that lend itself just to them, like one or two particular ones?
No, so it you can find up to, it screens for 70 different types of solid tumors.
70?
Yeah. So anything ranging from things like brain cancer to colon cancer to liver cancer. So the way it works is that whenever, previously we talked about how some cancers take up to 10 years to reach a detectable stage.
Mm-hmm.
Whilst that cancer is changing and developing into something that can metastasize and kill you eventually, many times those cancers kind of grow a bit, and then your immune system kind of realizes something isn't quite right here and removes those tumors before they have a chance to progress. Whilst that process is happening, some of those cells actually fall off and go into the bloodstream. So that's what we're trying to catch with this TrueCheck liquid biopsy. We pick up cells at a stage when, hopefully they haven't produced any symptoms yet. And if that comes back as positive, then we can look and see what's going on with the kind of standard imaging techniques we have, including endoscopy, as we mentioned, or MRI or CT scan. So on average, out of all the patients that have this liquid biopsy, 97% will be negative, which is great news, because even though it doesn't rule out that you do have cancer anywhere in your body, it does give you peace of mind that at least you haven't got something that's quite advanced. But in the 3% of patients that do come back positive, then that allows us to, request CT scans, for example, for some things, or maybe upper GI endoscopy for things like stomach cancer. And so what we talked about before about catching tumors at stage 1 versus stage 4, that is true for most cancers. The earlier you catch your cancer, the more chances you have of either removing it completely, or having things like chemotherapy, radiotherapy, and treating that cancer more effectively.
Wow, that's incredible. So how often do you suggest people have these tests?
So first of all, it's important to note that these tests are for people who do not have any symptoms. Mm-hmm. And you can have these tests at least once a year. You can have them once a year. There's a cost, so that might be prohibitive for some people. It's not currently offered on the NHS, so it's only offered in a private practice. So for people who can afford it and for people who do not have symptoms, we offer it once a year. But if somebody came to me with, for example, any symptoms of cancer, like lump or bleeding, then I would recommend other tests. So cancer screening, we do have very well verified, long-standing tools for different kinds of cancers. For example, testicular cancer. I know a lot of your listeners are interested in men's health.
Yeah.
Best test for testicular cancer is an ultrasound. It's simple. As you know, I'm a radiologist. I do these all the time. So if anybody is concerned about anything to do with testicular cancer or the Felter lump, then the way forward is an ultrasound, not a liquid biopsy. But for patients who do not have any symptoms, maybe they've got a strong family history of cancer and they're feeling anxious about it, then liquid biopsy and true check is amazing new technology that you could only have dreamed about 10 years ago. It's in a way it's non-invasive and it gives you the opportunity to catch a disease that may be asymptomatic for years before it's caused any trouble.
Yeah, no, it just sounds amazing. I went for a full body MRI actually a few months ago, which was interesting, and everything was fine. So they looked at the brain, the heart, the lungs, and then all of the skeletal system. So that was interesting, and I guess this is an advancement from there. So if I was a patient then, if I was coming along to see you, what would a typical patient journey look like?
So, as I said, so patients come to us for two main reasons. We've talked about the cancer screening. So the other thing we do is an annual health check.
Yeah.
So what we do, it's called the longevity annual. And what we do there is we do a set of blood tests. And in those blood tests, we look for risk factors for cardiovascular disease, cancer. So it looks at things like your lipid profile, your glucose control, triglycerides. We do physical measurements, so blood pressure, weight, waist circumference. And then the interesting thing that we're quite unique in is we do a fitness assessment. So we have this total fitness assessment, which is done by Dan, our fitness coach. And in this, we assess 5 parameters of fitness. We assess aerobic capacity, we assess your strength, we assess your power, muscular endurance, and agility. And measures all these, and then I can compare those measurements to data that we have for people of your age and your sex, and I give you a score. So, for example, let's talk about aerobic capacity. So, aerobic capacity and strength are actually really highly correlated with how fit you are going to be later on in life, how long you live, and what your risks for developing disease are. So, for example, age 40, your VO2 max is X, and you're in the 50th centile for your age and sex, then that's a really good predictor that you are going to be doing well later on in life.
Ah, right, okay. That's really interesting.
And strength, same thing. So we measure grip strength.
Mm-hmm.
Grip strength is a really good predictor of disease later on in life.
So the stronger, the more cardiovascular fit you are, the less.
Cardiovascular fitness, that's more to do with aerobic exercise. Strength is more to do with muscle mass. So muscle mass is really well correlated with your metabolic health. So the more muscle you have, the more mitochondria you have, the better your glucose control is going to be. So, yeah.
Yeah. And then if you, again, I guess when you say things out loud, you're like, okay, so if you're healthier, fitter, cardiovascular wise, and stronger, you're likely to live a healthier life for longer. When you say it out loud, you go, well, yeah, of course. Like, that kind of makes sense.
Obvious.
Yeah.
But why isn't everyone doing it?
Exactly. I was going to say that, and yet people don't all do that.
Yeah.
How do you? That's a great point. Then, so how do you encourage people to do exactly that? Because we do, I guess, often take our bodies for granted. It's why we end up in unhealthy states, perhaps quite often. So, what in your program, helps someone change?
Right. So, at the end of all this, of our total fitness assessment, I take the patient's history, in which they would have described to me what they eat, how much they exercise, what their sleep is like, and there is no magic pill or magic bullet. So even though sometimes we do give prescription medications when needed, so for example statins, when required, blood pressure medications, medication to improve your glucose control, the biggest focus is on your lifestyle. Educated patients are motivated patients, and a lot of the information that I've shared with you today, when I share it with my patients, it's all kind of news to them. So I'd like to think that a lot of people would be learning when I have consultations with them, or through this podcast, or through this blog that I have, and it gets them thinking. As you said, it's obvious, but why isn't everyone doing it? And maybe it's because people haven't made the link between, you don't exercise just to look good, or you don't eat just because, you enjoy your food. Exercising and eating actually has an impact on your health right now, but also, way in the future. Mm-hmm. So what I try to do is, we actually prescribe exercise. If you had to put all the interventions that we have available to us to live a longer, healthier life, including pills and all the other amazing medications that the pharmaceutical companies come up with, exercise is by far the strongest intervention that we have to improve your health span and lifespan. It's free, there's no side effects, and there's no upper limit of the correlation between exercising and how healthy you are.
And is there a particular exercise that you favor, or is it literally the best exercise is the one that they enjoy, which means they do it?
Yeah, I mean, similar to nutrition, the best diet is the one that you're going to follow, and the best exercise is the one that you're going to do consistently. I'm very big on zone 2 training. So zone 2 training is, if you were to split your heart rate into 5 zones, zone 2 training would be keeping your heart rate between 60 and 70% of your maximum heart rate.
Mm-hmm.
And technically, it's a zone of training that you could do forever.
Yeah, one, like when you're running, that sort of thing.
Exactly. So zone 2 is sometimes described as the kind of exercise you could do. You could have a conversation, but it wouldn't be a comfortable conversation. So, I actually prescribe 120 minutes of zone 2 training per week for my patients. Some people do it in different ways. Some people find that cycling is, indoor cycling is an easy way. Some people like, brisk walking or slow jogging. So different people do it in different ways. So zone 2 training, very big. And also resistance training. It's so important to maintain your muscle mass. So you reach your muscle mass around age 30. And from then, there's a decline until the later stages in life. So you need to do whatever you can to maintain your muscle mass.
Yeah, that's actually just made me think of something. Yeah. What age does someone normally start to think about longevity medicine?
That's a great question. One that's, many people often ask me. Let's take an analogy of, savings. So say you're thinking of saving for later on in life, your pension or, making sure you're financially stable. You wouldn't start thinking about it when you're age 60. You'd start thinking earlier, right? So why would you start thinking about longevity medicine when you're older in life? The time to start is as early as possible. I recently had a patient who was 18 years old. And, whilst people who are 18 years old don't really have the concept of what it is to be older, I'd like to think that, I did make that person think about, later on in life and what you're doing now impacting what happens later on in your life. So the answer to your question is early, as early as possible.
Yeah, that makes sense, especially when you put it in terms of investment, because obviously one of the benefits of investing early is the compound effect. So it just builds and builds and builds and builds. Warren Buffett is really, a big proponent of that, isn't he? And I guess same with health. If we start putting in those basic building blocks when we're younger, it's compound effect. So we can be super healthy when we're 120, as opposed to starting when we're 100.
I think that's good. Yeah.
Great. Okay, so how do people find you? If people are listening to this and they're going, I want to book an appointment, I need to know, what my metabolic health is, and I want to know what I can do to live to 120. Where do people find you?
So we have a website. It's called longevitydoctor.net. And, you can go in and book consultations online. We also offer inpatient consultations at Nuffield Health.
Yeah.
We have a free 15-minute consultation for anybody who's interested in just having a chat and finding out if, what we're offering is the right thing for them. We also have an education section on our website. So we've got a weekly blog with, all sorts of interesting topics like, the ones we've discussed today. You can find us on Instagram, LinkedIn, Facebook, all the social media platforms. So if you go to our website, you're able to book a consultation or book a free discovery chat. And yeah.
Brilliant. Well, Philip, that's been really interesting. Loved every moment, and hopefully everyone listening to it as well. Hopefully lots of people now are sending you emails and getting in touch. But I thoroughly enjoyed it. Thank you very much, and have a great day.
Thank you, Ross. Speak soon.